Imagine a situation where a loved one is unresponsive, and the medical terms being used are confusing and overwhelming. How do doctors determine the true state of a patient's consciousness, and what does it all mean for their future? Brain death is fundamentally different from a coma or a persistent vegetative state because it signifies the complete and irreversible cessation of all brain function, including the brainstem. In essence, a person who is brain dead is legally and medically deceased. In contrast, individuals in a coma or persistent vegetative state still retain some level of brain activity, particularly in the brainstem, which can sustain vital functions like breathing and circulation, at least for a time. The core mechanism differentiating these states lies in the extent of brain activity and the potential for recovery. Brain death means there is absolutely no electrical activity or blood flow to any part of the brain, including the cerebrum, cerebellum, and brainstem. This complete lack of function means there is no capacity for consciousness, sensation, or even basic reflexes. For coma and persistent vegetative state, the damage is severe, primarily affecting higher brain functions responsible for consciousness, but the brainstem often remains active, allowing for some automatic bodily functions to continue. Understanding these distinctions is crucial for medical teams and families making critical decisions. For brain death, doctors follow a strict protocol involving multiple clinical examinations and confirmatory tests, like an apnea test to check for spontaneous breathing, and sometimes a cerebral angiogram or electroencephalogram to confirm the absence of brain activity. These tests confirm the irreversible loss of function. For patients in a coma or persistent vegetative state, diagnosis relies on clinical observation of wakefulness without awareness in PVS, or deep unconsciousness in a coma, alongside brain imaging and electroencephalogram readings to assess remaining brain function and guide prognosis. One key insider detail is the significance of brainstem reflexes. In brain death, all brainstem reflexes, such as pupillary light response, corneal reflex, and the gag reflex, are absent. This absence is a critical component of the diagnostic criteria. Whereas in a coma or persistent vegetative state, some brainstem reflexes typically remain intact, which is why a patient in these states might still breathe on their own or have a heartbeat without external assistance. This subtle but profound difference guides both diagnosis and the ethical considerations surrounding end-of-life decisions. Ultimately, recognizing that brain death represents the complete and irreversible loss of all brain function provides clarity for families and healthcare providers, enabling difficult but necessary conversations about organ donation and the cessation of life support. This contrasts sharply with a coma or persistent vegetative state, which, while deeply serious, still involve a living patient with some brain activity, requiring ongoing medical care and complex ethical considerations regarding their potential for recovery and quality of life.